Welcome to my presentation on integrating hepatitis B testing to antenatal care services of primary health care facilities in Kenya. This was a pilot study to look at the triple elimination and how to introduce hepatitis B into testing. These are my disclosure. In the goal of triple elimination, it starts with testing. And the main goal of that, or the triple elimination, is to prevent mother-to-child transmission and also improve maternal and child health. This has to start with testing, as I've said, and the diseases which are included in the triple elimination is HIV, syphilis, and hepatitis B. You can make it a quadruple elimination by introducing malaria or hepatitis C for that case. Looking at the three diseases, especially HIV and hepatitis B, HIV is way ahead by around 2 digits. However, for hepatitis B, it's very low. Globally, it is very low in terms of testing and treatment, and Africa has the lowest of all the regions, the WHO regions, and that shows how skewed and some of the inequalities in terms of the tests and in terms of the triple elimination. What really brings down all the barriers for testing are, especially at the ANC, limited to the tests, or they don't have access to those tests. And if they have access to the test, it is fragmented, one done at different points. Sometimes the time taken for them to get the results is quite high, and that really affects the number of ANC who come there. And if the distance is quite far, they may not even come at all. Then, if the test is not done there, then it is referred to another facility. All this do affect the quality of testing at the ANC. For that reason, in 2023, we conducted an independent research to evaluate the ANC panels, which is a prototype having 4 diseases: hepatitis B, syphilis, HIV. We included malaria, however, malaria is not part of the triple elimination. What we did is we integrated these tests into the normal routine at the ANC and the testing using the infrastructure of HIV at the primary health care facilities. The main aim was to evaluate the acceptability and the utility of the triple elimination panel. Today, I'm going to share with you the lessons we learned during the training when we were integrating that and the cost benefit of the test. We did it in areas that had a high prevalence of HIV. In Kenya, those places are Homa Bay and Migori, and then in other places where the prevalence of HIV is not high. This was done as a cross-sectional study, and we used questionnaires to fill in the responses. The panel I'm talking about, this is the panel I'm talking about. It has 4 tests, that is malaria, determined for HIV. It has hepatitis B surface antigen test. It has also syphilis test. All these were in one pouch, and they provided in this tray, and we used only one finger prick for us to do all those tests. That means here we had only one drop, another drop here, and another drop here. We waited for 15 minutes and we read the results and gave it to the mothers. This test now is available in the name of Determine Antenatal Care Panel. It was approved by WHO on 10th of July, and it has these contents. All these are included in the test, and now it is like one strip, and it composes of HIV, hepatitis, and syphilis. All the mothers who came to our facility, we tested them, and all who met our criteria, especially the second visit, and they consented, We used a questionnaire to gather information from them, and those information were confirmed using their booklet, which is the medical record for that case. We did one finger prick and draw blood and tested all the 4 tests using the prototype kit. Then we read the results, gave them the results, asked them their perception and the previous experience, and then the information which was collected in the questionnaire was submitted through the ODK. What did we learn from the training? We trained them not really on how to test, but on the workflow. And the test disparities now, when you have like 4 tests, how do you resolve them? And how can we improve the health? How can we improve the testing outcome? When we did that, we explained to them, we demonstrated to them, and then we allowed them to do the test. What we learned is that the concept of rapid test and using all the rapid tests, it wasn't new. That's something they are used to. And therefore, rigorous training may not be needed to roll out an added kit to the facility, and a refresher will suffice. They had a very good perception. All of them rated it 100%. That is excellent. And on the component that they rated include that the kit was accurate and effective, it saved time, and it minimizes the movement. Those are the high rated components. In integration, most of the facilities test, actually 99.3, they do test. However, of all the tests that are done, not all are done in the facility. They refer 25.5. That tells you why our training was easy, because these healthcare workers have been doing testing all along. When it comes to uniformity of what they test 2 or 3 tests, and most of those tests that are done are the mandatory tests. And if you look at that, those include HIV, which was done by 78.5, and syphilis, followed by malaria. Hepatitis is the lowest. Therefore, it lags behind, and by integrating this into the ANC, it stands to gain by 80%. When it comes to the testing of hepatitis, let me say this. The prevalence, yes, was low. It was at 1%. However, of all the mothers who tested positive, only one of them had done a previous test. That tells you that awareness is low, and that is the reason as to why the testing is also low. But some of them also say they don't test because of the high cost of the test at that particular time. And also, since we didn't have proper guidelines for hepatitis by that time, that also affected the testing. This is not a HIV forum, but let me just say this for the HIV forum, for the HIV, that the kit had a P24, and 7 out of the 47 who tested positive were positive for the P24. And out of this, 2 of them actually tested for only the antibodies. And that will help in terms of timely management of HIV too. Other things that were tested, and the advantages include, or the benefits include, all the tests will be provided as one package, and therefore it makes it available. All the 4 will be made available, because 80% of the healthcare workers attributed shortage of reagents and stockout as the main reason of not testing. In terms of the health care workers' time, it saves them 75 minutes. That is a lot. The other test will take 113 minutes, but this will only take 39. This includes the time when the mother comes, when you test, consent and all that. It takes only 39 minutes. I know it will be lower once this is rolled out. Saving on time is critical. Why? Because most of the facilities, 62 actually 0.5, had only one nurse who was doing all these tests, and therefore saving on her time is very important. Referral is minimized to 0, and that is very key. Data is another big thing, and it is very important that we document our data. Having all the tests in one harmonizes the goals of triple elimination. It minimizes the missing data, and therefore we'll have all the three data streaming in at one time. That makes it easier for timely decisions and at the national level and at the global level. And the transmission of the data, if it is transmitted to the national health information system, it makes it easier for the policymakers to look at all the diseases, that is HIV, syphilis, and malaria, at one point without any missing of those data. In terms of the mothers, it really saves on the health care facility. Why? This test uses only one finger prick, and that helps in terms of the overhead, gloves, tubes, for collection of the samples and all that. In procurement also, the process of procurement, it brings it down. Only one person is doing this test, and therefore it also minimizes on the human resource. That, if it is accounted for, it is 47.4%. That is used for the health facility. To the mother, this test, there is no referral, therefore it lowers the time he comes. Timely results lowers the time the mother receives the results, and that really accounts for 9% of the mother. It is quite important that this will really solve the issue of delayed results. One of the mothers said this, that this is indeed a game changer, since everything is packaged together, and therefore the test is done at one point. It will not waste time, and he will not come to follow up the results. What am I saying? This is what I'm saying, that this innovation of combining tests together in triple elimination saves a lot, 47 to the facility and 9 to the mothers. In terms of time, it indeed saves the time of the mother and the time of the healthcare worker by 66.9. That is very important. It minimizes the referral, and in routine, moving from one facility to the another, it minimizes that. It concentrates it into one. And in data, the data consolidation, very important for timely decisions and accurate data for the key policymakers. In conclusion, let me say this: the Ministry of Health should invest in innovations which are easy, especially for us to achieve the triple elimination. And using the 4 ANC panel will scale up all the tests, yes, but hepatitis, which is lagging behind, stands to really gain in this innovation. Then to the health facilities, they may not really need the training because most of them have been doing this work before, and therefore just we have the capacity for us to deliver. Integration is the main goal in this, that we need to integrate this into the ANC, and this should be done without necessarily increasing the stigma. The stigmatization, especially for HIV, should be minimized when we are introducing these other tests. I would like to thank the partners, that is those institutions that participated, and my other co-authors in this work. These partners include the county, the healthcare workers who did that, AMREF and KEMRI who really helped to do this, and the Ministry of Health and other stakeholders who contributed so much to this, Apport team for providing the test, and also COLDA for giving me this opportunity to present. Thank you very much. Asante sana. Thank you.